Welcome to our roleplay about interdisciplinary hospital management. Today, we will show how different healthcare professionals communicate and work together. In this scene, the interdisciplinary team meets to align their care plan. This team include the internal medicine physician, nurse unit manager, healthcare administrator, dietitian and clinical coordinator, and the social worker and the case manager. Their goal is to make sure everyone is coordinated before talking to the patient.
Hello, good morning. I've received a lot of concerns. So tell the other staff that we're going to have a meeting. ASAP. Thank you.
At City General Hospital, interdisciplinary teams work together to tackle challenges in patient safety, staffing, and hospital operations. In this roleplay, we will highlight how different departments communicate and collaborate, aligning priorities and sharing responsibilities to provide coordinated and effective patient care.
Good morning, everyone. Thank you for attending. Today's objective is to identify gaps, align priorities, and make strategic decisions. So let us begin.
So good morning. From the nursing standpoint, we are facing high workload pressure. The nurse-patient ratio has exceeded safe limits in multiple wards. So we request urgent intervention.
As a nursing supervisor, to reinforce that point, night shift staffing is critically low. Our ability to respond promptly is compromised. If this continues, burnout will accelerate. We risk losing more staff if support is not given.
So HR, you've heard their concern. What can your office offer?
Hi, good morning. I'm the HR manager. So we recognize the gravity of the situation. However, hiring is delayed due to the budget approval. So we are evaluating temporary staffing contracts as a short-term solution.
So respectfully, HR timelines do not match the clinical urgency. So patient safety cannot look for paperwork.
Director, I would like to clarify, while understanding the clinical needs, we cannot bypass compliance procedures. Fast hiring without screening risk service quality.
I may interrupt. Frontline staff feel unheard. So we are requesting the management to walk a mile in our shoes.
To spend more time firefighting than providing quality care. We are stretched too.
When they happen, we are reminded that this is a failure and acknowledge that discourage staff.
And supply requisitions come late. Last minute requests led to staff gaps and unnecessary rush orders.
Inconsistent diet order result in wasted food and delayed meals, so patients can complain diets are changed but not communicated.
Rehab referrals are often late, especially post-surgery. Early intervention could shorten recovery time.
We share these concerns because unclear communication lead to inefficiencies and unsatisfaction of patients. In-time feels lost, unclear and over protocols means we receive incomplete information. I receive complaints daily. Family feel informed. They expect transparency and timely management.
As a family representative, that is correct because waiting for hours for update that causes anxiety. We need better to coordinations and compassions.
Let us not turn this into blame assigning. Our aim is solution building and we operate as one organization. Okay? So, to move forward, I propose action points using the principles of collaborative accountability. Okay? So, the first one is deploy float nurses to high demand units immediately. Second one is implement weekly interdisciplinary huddles to improve communications. The third one is to pilot a digital requisition system for medication and supplies. The fourth one is to decide a patient update protocol to be executed twice daily. And the fifth one is expedite HR processing by streamlining screening steps. Okay?
So thank you so much. This approach demonstrates responsiveness, so we're ready now to cooperate.
We will revise the hiring workflow and collaborate with the nursing to fast-track approvals.
Pharmacy will align with digital requisition and adjust cut-off times and to support wards.
My office will improve forecasting and requires wards to submit earlier.
And so I will implement reporting systems for diet, trains, and food and waste.
Our unit will create a simple referral checklist for early physical therapist involvement. Doctor commits to clearer documentation and handover coordination. We will intensify patient family updates and feedback monitoring.
We appreciate care guidance. This will strengthen our learning.
We thankful to our management by acquiring our concerns. One day, I hope one day that our concerns are visible soon.
Okay, so excellent contributions. Now let us proceed with the accountability and urgency. Remember, our success depends on our unity of purpose. Okay, so that's all. Meeting adjourned.
This scenario highlights the importance of teamwork, clear communication, and shared responsibility in achieving effective outcomes. By working together, hospital staff can address challenges efficiently, support one another, and provide high-quality patient care. It also shows that collaboration and understanding across different departments are essential for success in any professional setting.
The meetings begins as the international medicine physician opens the huddle.
Let's keep up on this huddle to align on which strategic huddle. Care roadmap. There come revitalize. We need cross-functional collaboration across departments.
Agree. We already established a care pathway to ensure seamless help. Hands off between shifts, but we need to optimize resource allocation. Her home health needs are growing.
From an ops perspective, we'll leverage our network of community clinics to reduce hospital administrations. This will also help manage cost efficiency for both the hospital and patients.
I've developed an integrated care plan that combines dietary restriction and medication guidelines. We need to ensure good quality so that she follows the recommendation.
I'll act as the point of contact for her family and insurance provide. My goal is to navigate administrative barriers so she gets approved from her dialysis quickly.
Miss Jahara.
Hello, Mom.
We wanted to walk our top unified plan for your care. No more completing instruction from different teams.
Thank you. I've been worried about juggling this with my business.
We understand. That's why we've tailored the plan to fit your work hours. Your dietary and medication schedules will align with your workflow. So you can still run your company.
I've already initiated the referral process for the health service. I'll handle the logistics and insurance, equipment and device, and training for your caregiver. To make things easier, we've set up a centralized portal where you can access your records, book for appointments, and message to them. They will enhance community and efficiency.
We also assign a dedicated care navigator to check in with you weekly. They help you.
Our ultimate goal is to achieve optimal health outcomes while letting you maintain in your daily life. Do you have any question of this?
This is exactly what I needed. Thank you for thinking through everything.
Thank you so much, Ma'am.
The health professionals discharge patients who are capable of performing home dialysis and to implement a post-discharge care plan that includes continuous monitoring and a support recovery to manage your condition successfully in their environment.
The solution.
Frontline staff. Clarify.
And also supplies. Remember her. So
Thank you for watching!